Please can you present your findings?
I suspect this lady has an underlying diagnosis of lung cancer. This is evidenced by clubbing in her fingers. On examining the chest, she has a tattoo, possibly from a radiotherapy site. She has no other chest signs. Examining her mouth, found poor dentition and evidence of oral candidiasis.
Okay, so if you had a patient that you suspected had lung cancer in the clinic, how would you proceed with investigations?
So initial investigations would include blood tests. These would be routine blood tests, including a full blood count, looking for signs of anemia, but also signs of infection. A CRP would also look for signs of infection. Liver function tests, looking for evidence of liver dysfunction from metastases, and kidney function, which may be guided for future treatment, but also for hyponatremia, which is associated with small cell lung cancer. She would require clotting if there was going to be any interventions done later down the line. Next steps would be spirometry and sputum analysis. Spirometry would guide fitness for surgery as well as the overall lung function. Chest radiographs, in particular chest x-ray, would be carried out. If the history was suspicious enough, then you would go on to a staging CT, so CT, chest, abdomen, pelvis, to look for evidence of malignancy and metastases.
Okay, so let's say you've done that, you've got a CT scan and that looks like the patient has lung cancer. How would you then proceed?
So the next step would be trying to identify a tissue diagnosis. This can be done via bronchoscopy. It can be done ultrasound-guided bronchoscopy, or also it can be done percutaneously through a radiologist.
Okay, and then let's say you have your histological diagnosis and you've confirmed a lung cancer. Can you tell me about the different types of lung cancer we see?
So lung cancer can be divided into small cell and non-small cell cancers. Non-small cell cancers are predominantly adenocarcinoma and squamous cell carcinomas.
Okay, and how's lung cancer treated? Tell me how small cell lung cancer is treated.
So small cell lung cancers often aren't amenable to surgery, so would require initially an MDT approach. Patient choice would also be important in deciding the treatment, but predominantly chemo and radiotherapy would be the treatment of choice.
And what about non-small cell lung cancer?
Non-small cell lung cancers, depending on the location, but often treated with surgery or radical radiotherapy.
Okay, and if non-small cell lung cancer was more advanced, how would you treat that?
So chemotherapy may be required, and there are more modern medications which target specific cell signaling pathways, which can be used.
How might someone present with if they had lung cancer?
So initial symptoms may be a persistent cough, and this may be productive of blood. Patients may also have weight loss. They may notice a change in character of their voice. They may have signs of SVC obstruction. This may be facial swelling, arm swelling, distended veins. They may also have symptoms of complications of lung malignancies. So hypercalcemia can cause thirst, bone pains, and confusion.
Okay, thank you very much.
Thank you.